This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us. We're going to discuss in detail today the auxiliary, what it is and some of the special events they have coming up. And we've got a full studio this morning. So I'm going to start from my left. Chris Battin is with us, who's been here before. Good morning.
Good morning.
Thanks for coming in.
Thanks for having us.
What is your role with the auxiliary?
My role with the auxiliary is fundraising chair.
Okay. We have directly across from me, Bethann Gamponia. Good morning.
Good morning.
Thanks for coming in.
Thank you for having us.
What's your role with the auxiliary?
I am currently the auxiliary president.
President, okay. And then to your left, to my right, you've got the auxiliary vice president and Amy Tallman.
Yes, good morning.
Good morning. Thanks for coming in.
Thanks for having us.
Let's start with the president and the vice president. What drew you to this organization?
Well, the auxiliary is all about, obviously, it's volunteering, community, helping patient care. The auxiliary itself, we volunteer a lot, but we also have a lot of fundraising that we do that supports different projects within the hospital. So that's probably what drew me into the auxiliary.
Amy, what about you?
I feel like I just wanted to get more involved with the community and help out, raising money for the auxiliary. I've been an auxiliary member for a really long time, actually. So yeah, and when Bethann called me with an opening, I thought it was a good opportunity to get more involved.
So you know what the organization is all about. And Chris, let's take one step back. You're a veteran with the auxiliary. Why don't you explain to the listeners, maybe somebody out there who doesn't know what we're talking about, hasn't heard of this arm of Mon Health in the hospital, exactly what it is and what you do?
So the auxiliary are volunteers. There are volunteers at the hospital that work directly with patient care or work in the gift shop. And then there are volunteers that are like the ambassadors of the hospital to the community. So we raise awareness of health topics coming up, which we'll talk about later. And we raise money to help support patient care.
Okay, when you say you raise money, where does some of that money go to? Give us an example of what you're raising funds for. So
the Ball of the Year, which is one of the biggest projects that we celebrate our 60th anniversary with the Ball of the Year. The past two balls, we raised money for the Care Cottage, which would be a stay home for the families and who have patients at the hospital for a long period of time. They have a place to stay. Mm-hmm.
So the Care Cottage is a project that's in progress, correct?
That's correct.
Who wants to take that one on as to where that stands?
So we're coming along with it. It's kind of on the corner down from the hospital. If you've been by it, it's kind of sat empty. We finally got a foundation. There's some trucks, some utilities. We're moving along with it. I'm not positive when the projected date is. We had some issues with construction as always, but I think it's going to be great. I think the house itself looks really nice, and I'm hoping it'll be a really nice thing for families that come from outside areas. We have a lot of rural patients that come in, so hopefully that will be a great thing for them. And I think it's not too far, is it, from being? I don't think it's too far from being projected to be finished this year. Yeah.
Sometime in 2025, back half
correct.
of 2025. Yeah. Okay, very good. Let's talk about some of the fundraisers, and the big one, the new one is the Derby, and we had Sarah McGuire was on a few weeks ago, and she really set the table for this, and she's working hard on it. So what, again, for somebody who maybe missed that conversation and is hearing about the Derby for the first time, how would you sell it? Go ahead, Chris, start with you. We'll let you each give an opportunity to sell the Derby.
Well, as people know, the Ball of the Year was something that's been a traditional thing for 60 years, and with times changing, we thought we needed to make a change too. So we came up with the idea of having the Derby, which would be like a smaller group of people, but lots of fun anyways. And it's going to be our new annual fundraiser. So we are planning it. It's on May 3rd at the 4T Arena in Bridgeport. It's a lovely, lovely, perfect environment for our Derby. And it's going to be betting on the actual Derby live.
Wow. Okay. That does sound exciting. Bethann, what's your role in getting this one off the ground?
Oh, my goodness. Well, a lot. I've worked very closely with Sarah. She's a delight to work with. I've gotten to know her very well. The two of us and Chris and Amy and Jacob, our volunteer services guy, we have done a lot to get it going. So excited about it. It's going to be awesome. They've got she actually has live horses, so you can actually go out to the stables to see the horses. And I think it's going to be a lot of fun. We're hoping for a great turnout, and it's going to be a very different atmosphere probably than anything we've ever done before, kind of relaxed, and it'll be very nice.
Okay. Amy, your thoughts on this? What excites you about the Derby?
Everything excites me about the Derby. The hat, I can't wait to wear a hat because nobody wears hats anymore. So I think that's going to be a lot of fun to see everybody dressed their best, wearing their hats, and there'll be bourbon there too. So it's a win-win.
Yeah.
But it's very exciting, and actually the proceeds for the Derby will be going towards the CARE channel.
Okay. So the hats, that's a big thing. You take you got to put a lot of thought and a lot of planning into getting the right hat and making sure it arrives on time correctly, because you can't go to the mall and get one of these hats.
No, and coordinating it with your dress.
You're right, with the outfit. Yeah, and with the outfit of the person you're going with. This is big. This is a big part of this. Yeah. The hats. Okay, so where are you in that process, each of you, getting the hat?
I'm still working on it.
I have a feeling, Amy, you've got yours thought out.
I do. I have my dress. I made my hat, so I have it. Yeah.
Okay.
So my hat is done.
I may have to have Amy make my hat.
So you come over, Bethann, and I'll
have the dress.
help you with your hat.
You may have just discovered for yourself a cottage industry.
Yeah.
There we go.
Yeah.
Making hats for people for the Derby. Okay, so we talked about the Derby. Again, a new event that's going to be a lot of fun, and you're trying to kind of reach maybe a different group of people, right, for this? Chris, is that part of the thought process?
The tickets are $100, so that opens it up to
yes.
more people can. That seems more affordable than a big gala. So it's $100, and it includes some great food. We're trying to mimic the Derby as it is at the Derby, but in West Virginia.
Okay. And how can folks get the tickets? Is there a website? How do you go about making your reservation, getting a reservation, and getting tickets?
You can find everything out on our website. It's monhealth.com/derby.
Okay. monhealth.com/derby. That's very, very simple. And again, you mentioned the proceeds from the Derby going to the Care Cottage, and that's obviously a place for folks to stay when they're coming from out of town to visit maybe a sick relative or somebody who is in the hospital. Take a moment. I know we're not necessarily here to talk about the Ball of the Year, but let's just talk about its importance and what it's meant through the years and through the decades to the auxiliary and to raising funds.
The Ball of the Year usually involves like a project that the hospital needs that comes with it that our fundraiser could fund. Mm-hmm. So throughout the years, we've raised money for technology and a few years ago, equipment. Yes, equipment. Mostly things that we needed to do with the emergency room, to make it more accessible to people with dementia issues. So, but there's been many things. Even I think in the 90s they raised money. They had a projection to help build when they were adding on to the hospital. They put a lot of money towards the capital campaign.
Bottom line is you try to help the professionals in your building, in your facility, help them do their jobs better and also provide comfort to the patients.
That's
Correct.
Okay, very good. We are with members of the auxiliary with Mon Health, Bethann Gamponia, Chris Battin, and also Amy Tallman. We'll take a quick break here. When we return, we'll talk about some other ways the auxiliary is involved in the community and how you can get involved if you're interested in volunteering. They're always looking for volunteers. We'll continue the conversation on Mon Health Talk for this Monday right after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us. We are talking about the auxiliary and what it's all about, and specifically the Derby, which is coming up next month, May 3rd at 4T Arena in Bridgeport. Tickets available for $100. So go to the website to make your reservation and get your ticket for the Derby. I learned an interesting fact. First of all, we're with Chris Battin, Bethann Gamponia, and Amy Tallman. You've each had a turn as chairperson for the ball.
Yes.
Right. So do you remember your specific years? Give me your specific year and what the highlight was for you. Chris, go ahead. We'll start with you.
Mine was 2017, and it was the 80s. It was the best of the 80s.
All right.
theme.
So a lot of 80s type music, that type of thing.
Yes. and
Footloose and Madonna and that
A
kind
lot
of stuff.
of we had a lot of things that people kept in their closets over the years, where they
Yeah.
were like their Letterman jackets and
Huh.
the Rubik's Cube and
Well, that,
yeah.
I'm sure that was
Cabbage Patch
a
Dolls.
great success. Beth Ann, what about you?
Mine was in 2008, and it was the first ball to come back to Morgantown from Nemacolin. We had moved it to Nemacolin. It had been in Morgantown, moved it to try to spark interest again, and moved it back to Morgantown the year I did it. So that was probably the most significant thing about mine. Mine was a masquerade ball.
Okay, so probably a lot more work, right? Moving
Yes,
it back.
it was. Yes, when they asked me to do it, I thought it was still going to be at Nemacolin, and then I was told, we're moving it. So,
Okay.
yes.
Amy, what about you?
Mine was 2015, and it was Night of Intrigue, which was a James Bond themed ball. So it was really a lot of fun to
Okay.
take that on, and we had some really fancy cars. I got to ride in a Bentley.
Wow. Okay.
Yeah, inside the room, but they moved it, and I'm like, can I get there real quick?
All right. So a lot of fun and a lot of good works through the year with the ball of the year. Okay, let's talk more about the auxiliary and some other ways the auxiliary is involved with the community beyond fundraising. Tell us about the Drug Take Back Day.
That's getting ready to happen, actually, April 26th. And so you can clean out your medicine cabinets, bring all of your old medications to the hospital. We'll have an auxiliary member there, volunteers to help take back the drugs. And then it's a safe way for you to dispose of your medications that you no longer need.
Much better than flushing him down the toilet.
Correct.
Yeah.
Yes, much better.
So the Drug Take Back Day, April 26th, does that go all day? Or
It's from 10 to 2.
Okay.
And at the hospital grounds, we have 2 drop-off sites. One's in front of Mon Health, and the other one's at the Village,
Right.
the Heritage, and Kroger also does it at this Suncrest Town Center.
Okay, so Drug Take Back Day coming up on April the 26th, 10 until 2 at those locations. Okay, junior scholarship. So the idea there, investing in the next generation of doctors and nurses and people that work in the hospital.
Right. So that one is, we're getting ready to actually review that and pick the recipient of that scholarship. We give a scholarship to a junior volunteer. They have to write an essay, application, have had so many volunteer hours at the hospital. Then we within our board we have an health education chair, and she and her committee and I think myself look over the applications, and then we'll pick the applicant that we feel best deserves the scholarship.
So these candidates are volunteers, right? They're in the hospital
Yes.
working?
Yes. Correct.
Excellent. Okay, speaking of volunteers, if I come into the hospital, there's a pretty good chance, there's probably 100% chance I'm going to run into someone who's volunteering their time to help the hospital, right? People at the desk, people at the gift shop. So talk about that a little bit, how important volunteers are.
It's very important. I used to be a volunteer. I volunteered at the front desk every Friday for years. We have volunteers. In the gift shop, like you said, we have pathfinders that help people navigate their way through the hospital that aren't familiar with where they're going, or maybe they need a wheelchair. So you will find volunteers in every corner of the hospital.
So greeters, right? People that are there if you
Yes.
need help getting to and from your car, as you say, getting into a wheelchair. The people at the desk volunteer their time. So that's outstanding. If someone is out there listening, how can they volunteer if they want to step up and help the hospital or the auxiliary for that matter, right?
That's correct, because we're volunteers too.
Right. Okay, so how do they get involved? What's the first step?
They can call the hospital and talk with Jacob Mulder, who is the manager of volunteer services. And he is the person you would talk to get yourself, whatever you need to, paperwork and that kind of thing done so that you can become a volunteer.
Okay. Any requirements at all to be a volunteer? You guys have all done it, no?
No.
Just be willing to
Be willing to give your time.
and do whatever, right?
Right. Yes.
Do whatever needs to be done. Okay, so Jacob Mulder is the individual to contact at the hospital if you want to volunteer. And I also see here that it's National Volunteer Week coming up. That's next week, I guess, April 20th through the 26th. So what would you all say to you've been volunteers, you know how important volunteers are to the day-to-day operations of the hospital. What would you each say to the volunteers in terms of thanks and encouraging folks that may be wanting to get involved? Chris?
I'd like to say, if there's any volunteers listening to this radio station right now, we want to thank you so much because it really enhances the patient care at Mon. And you're always behind the scenes. Most volunteers don't like to get acknowledgement, but Volunteer Week is the time when we have acknowledgement. There's little activities going on in the volunteer workroom, and then we'll have a luncheon for them. Jacob's planned a really nice luncheon for them, and it's a way to recognize people who've had so many hours too. They get credit. They track their hours, and they earn a pin for every so many hours that they've volunteered throughout since they've the
Sure.
lifetime of working at Mon
Absolutely.
or volunteering.
Bethann?
Right. Like she said, we would like to thank everyone that helps. I think we also need to remember volunteers and the auxiliary, while we are sort of separate at the moment, but we're really not because we are all volunteering for the cause. Of volunteers in the hospital maybe work more directly with the patients and the staff. The auxiliary raises more funds for those patients, but we also, as an auxiliary, do make care packet things for people in infusions, and while they're sitting there for hours getting their infusions, and they have some crossword puzzles and things like that we put together and we hand out. We have a care closet we do. Again, if you come to the hospital and you have you're in an accident or something and you get your clothes cut off, you can go to our care closet and get. And those are some things that we as volunteers do also. And I agree. We also will be picking that week and at the luncheon a volunteer of the year, and that person will be recognized then.
Okay, outstanding. Amy, in terms of volunteers.
Again, thank you to all the volunteers out there. I think it's a really great way to give back to the community, and it's very rewarding. And for those who maybe just need a social outlet, there are activities that they can do. You meet a lot of nice friends, a lot of good people, and it's just a good way to get out and help out.
All right. So, again, if you're interested in volunteering, get a hold of Jacob Mulder with the hospital. And we got a minute here, so let's quickly recap some of the dates and the events we talked about. National Volunteer Week is April 20th through the 26th. The Drug Take Back Day comes up on April the 26th from 10 until 2, and there are intake locations at the hospital, at Heritage, right, and at Kroger. So keep that in mind. And, of course, the Derby, May the 3rd. So there's still plenty of time to make your plans and get your tickets. So you can do that by going to monhealth.com/derby.
The Derby.
The Derby.
The Derby.
Okay, monhealth.com/the Derby. So all the information's there, and the availability of tickets is there. Well, this was fun. I appreciate you guys coming in.
Thank you.
It's
for
always
having
good
us.
to see people face to face. Most of the shows we do via the phone, so I appreciate you coming in, and it's nice to see people face to face. Bethann, Gamponia, Chris Battin, and Amy Tallman, all with the Mon Health Medical Center Auxiliary. Thanks again.
Thank you.
That is Mon Health Talk for this Monday on WAJR.